We have an incredibly sought-after celebrity doctor with us today. Dr. Olivia Lesslar is an Australian-educated medical doctor. She has completed postgraduate studies in skin cancer medicine and clinical nutrition management, and she is currently undertaking a diploma in clinical hypnosis and strategic psychotherapy. Her unique skill set is in problem-solving multi-system chronic conditions. This is the doctor that lots of doctors ask for help because she's so incredibly experienced with such a multifaceted background. She works with innovative, high-profile international clinics and institutions, including the preeminent Los Angeles celebrity concierge company Lifespan Medicine. She is the medical director of functional and longevity medicine at Cingulum Health, a brain optimization clinic where she curates personalized programs of synergistic adjuncts for neuroplasticity, including transcranial magnetic stimulation, hyperbaric oxygen, photobiomodulation, breathwork, and nootropic peptides. Dr. Olivia is the Chief Medical Officer at Atlus, an Australian medicinal plant medicine clinic. Dr. Olivia is on the clinical advisory boards for Oxford Healthspan in the UK, the Naked Pharmacy in the UK, the Human Regenerator in Germany and the UK, Holistic Health Institute of Australia. Oh my gosh, this list is so long. And she is a trustee of the British College for Functional Medicine. Okay, there's so much more I want to say about this incredible doctor, but you're just gonna have to find out for yourself listening to how absolutely brilliant she is. Get ready for Dr. Olivia Lesslar. Oh, what an honor to get such a brilliant doctor on the podcast today. So I know that you are a doctor to some celebrities, right? I'm curious to hear if these celebrities get any special treatment. I'm sure it's difficult with a busy schedule and especially your busy schedule as well in the traveling that you do. Is there any recommendations that maybe they have that normal people don't necessarily
Yeah,
get
I,
recommended?
I, I hear the question. So my practice is such that I don't follow patients through from start to finish. So I'm not like a GP or a normal specialist. So what I do is higher order, in inverted commas, higher order consultations. So patients don't quite know what's going on, or they've hit a wall, or they want a second opinion, or they want a left of field opinion, and that's when they find me. So I do maybe one, two, max three consults. If I can't figure it out or give you something that you feel has really moved the needle within three consults, then I ask you to go see someone else and possibly come back in 12 months because you know how many conferences I go to.
Yeah.
My knowledge would upskill by then. So that's what I do. But the celebrity patients I see, those are concierge patients. So my commitment to them is different. I see them regularly, or I communicate with them regularly at least. And is there a big difference with recommendations? There is. And the number one thing is this: I never want my patients to feel like they're missing out on something because they don't have money, opportunities, the freedom to travel. Because I truly, and this is the talk that I gave that you saw me at, I truly, truly believe that healing is found within. It's in your heart, it's in your soul, it's in your head. So I emphasize that with my celebrity patients or patients who have a little bit more money, you know, they tend to like to buy toys, and I'm here to advise. I'm here to facilitate, but the message is still the same to them. You know, if you're trying to externalize your salvation, you're going to find that that is a dead end. It's a moot point. So, you know, they'll spend money on retreats or stem cells or, you know, plasma wands or whatever it may be. But the message from me will be the same. You can play with that, but don't forget about what really counts, and that's what's inside.
Definitely. Is there a clear recommendation for them as far
Oh,
as working on this? I can't imagine the different stressors and
yeah. So, you know, there definitely is more stress in politics, high level sports, Hollywood, for sure. Absolutely. But the root of those problems is the same as everybody else's. Goes back to unresolved childhood traumas, adverse childhood events or adverse childhood experiences. It goes back to attachment styles and all the rest of it. So I tend to talk to patients first and foremost about emotional health. And emotional health is something that we all deserve, but we have to work on it and we forget, right? We're too busy taking drugs, taking supplements, and sitting in front of our red light panel.
Right.
So I am a big fan of emotional healing in whatever shape or form sings to you. Personally, I recently did something called Liberate, Liber number 8.com,
I
right?
actually did that
Oh,
too.
sorry,
Love it.
Liber 8.health.
Yes.
And oh, you did it as well. It's great, isn't
Yeah,
it?
the
Like it's
mapping
just
session is so good.
right. Liberate.health is liberating, funny enough. And it taught me, even though I'm a psychoneuroimmunologist, it actually reinforced and taught me things that I hadn't opened my eyes to about the importance of emotional health, like true emotional health, not just being able to label the emotion or set your boundaries or, speak your mind and being self-compassionate. Those things are very important, of course. But when you really get into the weeds with emotional health, with the literature around emotional health and how that affects physiology, it's mind blowing. I recently have been quite enthralled with the work of Alia Crum, so Aliacrum. She's a psychologist at Yale. And actually, the first time I ever heard her heard her name was in regards to an allergy clinic that I was working at or work with like 3 years ago. So I still consult to them. And I went back to the professor recently. He said, I remember you telling me about a psychologist who did these experiments whereby if you give a patient with nut allergy a benign substance, but tell them or imply that there's peanut in it, they will have an anaphylactoid reaction. They will have hives and wheals and wheezing. So the body reacts in exactly the same way because you believe it to be true, right? And so that is not just our psychology, but if you feel something to be true, if you feel rejected, abandoned, anxious, that has physiological knock-ons. So emotional healing is very important for my patients. I don't care who they are. Then the other things that are neglected, because in our medical realm, we tend to focus on physicalities, symptoms, symptom mitigation, pharmaceuticals, and they have their place, of course. But health is wealth, and health is not just physical health, and it's also not just emotional health, right? It's mental health, it's brain fitness, all these other things that go into making you a whole person. So when I'm talking to patients about brain health, for example, or mental health, nutrition, of course, is going to be very important. Holding on to positive energies is going to be important too. Maybe I should state this in a different way. If you're constantly thinking negative thoughts, that does affect your physiology.
Mm-hmm.
If you are exercising your brain and doing novel tasks, neurofeedback training, for example, I personally use a device called Sensei, so it's SENS.ai. There are a number of neurofeedback devices out there, but this is just one that manages to combine photobiomodulation as well and EEG feedback. And it's all about realizing that all the different parts of your garden, so your brain, your heart, your mind, your body, they're all important. And you have to tend to all of them. And tending takes time. And we are so lucky in this day and age that we have these cool tools and apps to assist us. But that impetus must come from within, right?
Yeah. I'm really surprised to hear this with such an extensive background and so much experience. I was expecting you to say, "Oh, get this blood work done," or make sure that you know how, your levels of all of this and that. And instead, you're
Yeah.
talking about your past traumas and your emotional health, which is so fascinating. And I was just on another call with Dr. Zagoni. She is the founder of Clockwise, going over.
Yeah. I was on a panel with her at Dragonfly.
Yeah, yeah, she's
Yeah.
incredible. And it was so interesting. Similar thing that you're saying, to reverse biological age, their age will actually increase related to stress and related to trauma
Yeah.
very significantly. So it's not a surprise, I guess, but hearing this from you as well, I'm just like, wow, 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 wow.
There's something to it.
Yeah.
We know from ACE's research, adverse childhood experiences or events, that you have four or more, and your chances of obesity, depression, cardiovascular disease, cancer significantly rises. And a, a lot of lifestyle diseases or chronic diseases or non-communicable diseases have got some sort of aspect to it that we can control. Now, we can't really control what happened to us as a child, right? But what we can control is how we respond to what happened to us. So that's still in our hands. How we choose to move forward, how we choose to reframe the issues, how we choose to see ourselves and our perpetrators or oppressors compassionately with forgiveness, if appropriate,
Mhm,
and then how we choose to embody the lessons and
mhm,
then treat others, especially our own children.
mhm.
So, I don't think many of us got away scot free from childhood without some big T or small T
Right.
traumas, right? But we can wallow, or we can do something about it. And knowing tangibly that doing something about it can have like serious positive effects on physical health. My role as a doctor is to make sure that my patients are given as much information as possible, and so that they can make informed choices about what they're doing for their health. Because if they're going to be spending another lot of funds on supplements and interventions and biological age testing, I mean, these are things, of course, I do as well. But it's within my remit to make sure that patients know that emotional health, brain health, mind health, all these somewhat seemingly non-quantifiable, non-qualifiable um, uh, levers are as important and sometimes more important than popping another pill, basically.
Totally. And this is something with my patients, they get frustrated because it's not something that they can just check off the to-do list. Oh,
Yeah,
I
yeah,
was
exactly.
I reacted positively to this thing, like done, it could come out of nowhere. Whereas something like taking a supplement or exercising, it's you can just check it off the list. So it becomes kind of murky waters. And I do have some tools for that, having reminders on your phone with little affirmations or little mantras that land for my patients. I know that you're in the realm of hypnosis and all of this um cutting edge technology, I think, to implement. And I'm curious what this might look like, if you might be able to describe just
Sure.
certain
So
tools.
I don't practice hypnosis myself. I am actually doing a diploma in clinical hypnosis and strategic psychotherapy, but I don't
Mm,
practice hypnosis myself. I will refer patients. I have immense respect for all the psychology modalities, including EMDR
mhm.
and CBT and so on and so forth, because there's a reason why there are so many flavors at Baskins, because not everybody has the same taste buds, right? So, what I do specifically in my brain clinic in Sydney, where I'm the medical director of functional and longevity medicine, is that we actually do connectome mapping of the brain. And a connectome map is taking vectors and BOLD, so that's blood oxygen level determinations from a resting state MRI, and we're able to map essentially the main bundles of electrical highways in the brain, which organize themselves into networks: default mode network, central executive network, auditory network, and so on and so forth.
Wow.
Then we are, as far as I know, the only non-neurosurgical clinic in the world that then sees which of these networks are like overfiring or underfiring within a network and between networks. Then we
Wow.
correlate that to the real estate on the cortical surface of the brain. This is called a parcel or a parcellation. And then we use a theta burst stimulation, which is a form of TMS, transcranial magnetic stimulation, that was molded on the Stanford protocol
Wow.
uh, to essentially deliver this magnetic field around that parcellation to affect the connectome. So I don't do hypnosis, but check out this other thing that I do.
That sounds
so
so futuristic.
so we essentially, it is a shortcut to neuroplasticity. A session of TBS is about 6 minutes, maybe 5 minutes, something like that.
Wow.
And then you've got a window of about 20 to 35, 40 minutes of neuroplasticity. In that time, we will adjunct the TBS with some other modality: photobiomodulation, hyperbaric oxygen, precision emotional healing, neurofeedback training, visualization, breath work, whatever sings to a patient, right? Part of what we're doing is trying to expose patients to the many, many healing modalities that are out there. And again, as I said before, some will sing to you and some won't, and that's fine, right? It's about trying it all and seeing what your cultural and emotional and intellectual brain is going to gel with. But we see great results, especially for things like anxiety, depression, rehab, post-stroke, because the brain is a very difficult organ to deal with. And we know almost next to nothing in the grand scheme of things. But we do know that neuroplasticity is very important for the entirety of your life.
Oh
And
yeah.
that's why people can surmount. I mean, you do fasting stuff with Voltalongo, don't you?
Yeah.
Right. So autophagy inducement and other things, which is going to also affect neuroplasticity, is really important, because the brain never stops growing. The brain never starts learning. And you know what? That's the same for the heart. Heart never stops learning. Heart never stops growing. And when you stagnate by overindulging in ultra processed food or reality TV or relationships where you've outgrown them and you stay in them for whatever reason because you haven't been able to face yourself.
Mm.
These are all levers that we can try to flip with the goal of true whole health.
This is so cool. I can't imagine this being possible. Like it sounds like I can really clearly see it being beneficial for a stroke patient, having this neuroplasticity. Do you happen to have any particular testimonial that comes to mind that you're able to share?
So for TMS, look, we have several, and in fact, I don't know about in the US, but in Australia, you're not allowed to put testimonials on your website. I think that's changed very recently, but you're not allowed to put testimonials on websites. So it's not something that is at the tip of my tongue. However, people are, of course, allowed to talk about their experiences themselves, right? And so Instagram is the place where some of our patients have uploaded
Even you,
videos and photos.
do you
Hmm?
happen to have a testimonial just with yourself with these different modalities that you might be willing?
Oh, yeah. Okay. So we had a patient who had severe sleep issues, anxiety, the works, anxiety, depression. Um, she came through. She did 5 days. So it was an accelerated program, which is usually what we do, 5 days or 5 TBS sessions a day, with hyperbaric oxygen, low pressure, full body red light therapy, neurofeedback training, visualization breath work, stress resiliency training,
This is
and
so much.
yeah, so again, it's trying to expose patients to all these different things, right?
Yeah.
And the other thing that we try to foster in our clinic is that it's not clinical. It doesn't feel clinical at all. There's lots of, there's lots of plants, and there are 2 dogs that are hanging out there all the time. And,
Love
patients,
it.
yeah, patients come in and they feel immediately at ease. And the point of that, of course, is the aesthetics, but it's to put them in a parasympathetic state. And in a parasympathetic state, that's when your body is able to redirect energies into healing as opposed to into hypervigilance.
Mhm.
And at the end of the 5 days, she was sleeping better. Her um, her anxiety scores and depression scores went down. These are the patients who wind up coming off medications. Um, and I really appreciate that quite objective uh, part of helping with someone's healing journey, because medications can be a real crutch for patients. And sometimes, a lot of these patients have been led to believe that without these medications, uh, they can't ever be happy.
Mm,
And to be fair, a lot of these medications sometimes don't even allow them to be happy. They just numb the dark feelings, right?
totally.
Now, of course, the caveat here is there are absolutely medications which are indispensable.
Mhm.
But we need to make sure that we know that our toolbox is full of tools which we need to explore and understand and practice and utilize, as opposed to reaching for the script pad every single time and denying our patients those options.
This is so empowering to hear. There are a lot of tools, there are a lot of things we can do. And I like to think of these symptoms not being able to sleep, right? Even a crazy autoimmune or cancer diagnosis, these are definitely really bright check engine lights that whether it be trauma, emotional, or it could be a deficiency of sorts, it could be other blood
Exactly.
issues.
Yeah.
These check engine lights, I love trying on the perspective that this is an opportunity to grow and to change and to take care of ourselves with all these different tools that you're mentioning. And do you happen to have a lowest hanging fruit that maybe is your go-to if you happen to have a regulation tool that works best for you, or that you would recommend that maybe if you are in a rush or yeah, traveling and find yourself.
So I love, so lowest hanging fruit for me is always the things that you can do in a short period of time that doesn't require money, right?
Mhm.
So for me, actually, I love how the mind responds to how you posture. In other words, when you're panicking, you're like, and someone says to you, breathe, just breathe. And you kind of want to punch them in the face, but actually you do breathe and you do feel a little bit better. And this is because from a psychoneuroimmunology perspective, you have changed your behavior. So that's the breathing pattern, which then will change the nervous system. So the nervous system goes, oh, I guess we're not being chased by a saber-toothed tiger because you're not breathing as if we are. And then the nervous system starts to calm down. And of course, the knock-on effects from that. This also, and there have been studies on this in psychology journals, especially. If you smile, even if you smile, you actually start lighting up the parts of your brain that usually light up when you smile because you're happy, right? So these are actually tiny little neuroplastic pushes, right? If you We know, for example, a lot of patients who are depressed or who have severe mental illness, they tend to be hunched over, head down, and they tend to sit like this with their arms across their chest, right? Because this is a protective defensive position. And
Mhm.
so when I catch myself doing stuff like that, because I am tired or I am stressed or whatever, I make a big effort, lift my chin, chest out, shoulders back, palms exposed and out. And
Mm,
you, maybe I should find a different word for trick your brain, but you trick your brain into going down a different road.
mm,
The fact that these days we're constantly just looking straight ahead and possibly even down at our phone and our laptop, our TV, um, and also the fact that um, this is usually while sitting too, right? In other words, you are not in a position to run if you need to. Your lack of moving your head from side to side and surveying the landscape for danger, your lack of moving your eyes left to right in as far in a 180 as possible, actually makes your nervous system really twitchy because it's going, um, you haven't you haven't checked for danger. You haven't checked for danger. You haven't checked for danger. And so for our regular people, maybe you, me, generally speaking, like it's fine. You get it, whatever it is. I mean, how do you qualify whether someone at the end of the day says, "Oh God, I'm so stressed. Oh, I have a headache. Oh, my shoulders. Oh, my neck. Oh, this or that."
mm.
How much of that is actually because the work is stressful, and how much of it is because of how you were posturing, right? But we
Yeah.
do know, and I have seen this in clinic. Actually, it's a very interesting story. Um, this one patient, his nervous system was already a bit twitchy. There were some other things that had happened previously. He was exposed to pesticides on his farm, blah blah blah. And the straw that broke the camel's back was when he was put into a neck brace for some reason or other. He saw me after this. He was put into a neck brace and he panicked. The fact that he couldn't move his neck, he
Mm,
said he panicked and he ripped that thing off, and he just kind of wasn't really the same after that. And so that's when he came to see me, and we had to sort of change, first of all, help him understand why that happened, but then after that, just try and calm the entire nervous system down. Because with the nervous system, and to be fair, the PNI system in general, once bitten, twice shy. It'll take you a second to get into a fight flight state, uh, but it takes a little bit more time to calm the system to a baseline. And importantly, it'll flick into that state more readily, more quickly the next time it encounters the same sort of perceived threat. So posturing is very important, and that's free, and you can do it by yourself.
Thank you. Thank you for these tools. And yeah, next time somebody says just breathe, do not be offended. They're really trying to help you. I feel like this too. If I'm if I'm feeling depressed, anxious, irritable, um, a parent figure would say, take a nap. And I
Mm.
would be really annoyed. I'd be like, but it's true. Every time I would take a nap, these things like sleeping, breathing, these simple, basic, low-hanging fruit things.
Yeah, absolutely. Going for a walk, being in the sun, all these things is what I have deemed, or what I call in my papers, safety signaling.
Mm,
Tapping into evolutionary drivers denote to your nervous system that you are safe. The
mm,
fact that you can sleep, uh, or can go to sleep when you are stressed, tells your nervous system that you are not preparing for war,
mm, mhm,
not needing to sharpen your spearhead because there's a saber-tooth tiger, prowling the perimeter. Right? You have the luxury of going to bed. Okay, so things can't be that bad. Oh wow, you're in the sun, you're walking, and you're walking slowly. Are you afraid of being seen by an apex predator? No, because you are apex. Right? So these are all sort of ways to speak to your ancient brain, which is right there, right back there, right? You've got your cerebellum and your brainstem, and it is, it takes over when you are, um, when your body or brain or mind perceives you to be in harm's way, perceives a threat.
mm,
It takes over from the prefrontal cortex if the prefrontal cortex seemingly has let the body down over and over again.
mhm,
And that's why people who put themselves in stressful situations over and over again without uh, due diligence about also working on the mind and the heart, or worse still, they do it on their own and they're not in a community. So team sports is different. right? Because you're in a community, you're in a group, you're sharing that load, you're sharing that burden, right?
Yeah.
But otherwise, your whatever it is, every symptom that you ever get, I invite people to not only just think, oh, what is my body trying to tell me? But that's a great question to ask. But it's also how how is it trying to protect me? Like, what does it think is happening, and therefore it's trying to protect me? Because that's what, to be fair, most physical symptoms are. I know we're running out of time, so I'll give you one more example. I had a 5-year-old, 6-year-old in Japan, and his mother, I mean, he looked pretty good, but his mother said that 2 years before he had such severe eczema, they were treating him like a burns patient.
Mm.
Now, doctors know, or, well, actually, all health practitioners, healers know this. But in children, especially who haven't yet found their voice and who are not able to, they are a rag doll to their circumstances, right? They tend to express uh, anger, frustration, or any of these negative symptoms, these negative energies, through their skin or through their gut.
Mm.
So stomach pains are very common, for example, because the vagus nerve is just going crazy.
Totally.
And skin, because from a embryological perspective, the germ layers, the 3 germ layers, the ectoderm is the precursor, or the germinal precursor to the brain and the skin, the nervous system. So that's why cutaneous manifestations of psychic hurts can happen, especially with children, right?
Wow.
And so she told me that he had been, really, really ill. He had severe eczema, blah, blah, blah. And, I said, what was happening in the home at the time, and how are things with your husband? And she was like, oh my God, her husband, the father had cheated on her. She found out they were going through a very terrible divorce. He started to get this terrible eczema, which of course put more stress on the family. And eventually they divorced, and the son's skin cleared up after they moved into separate homes. And he wasn't subjected to that yelling and fighting and throwing of things, you know?
Oh,
So,
I'm not surprised. Yeah.
mhm. So
This
then
is
the question is, how does itchy skin mean that your body's trying to protect you? Makes no sense, right? And this is where I'll leave you with this one. When your body is under threat, real or perceived, okay? When your body is under threat, it will initiate some broad strokes, first protocol things. It will increase mucus because possibly the threat is a pollen maybe, or something that shouldn't be in your airways or in your mouth. And so you increase mucus and you get postnasal drip, and you get stuffy nose, and you get more fluid coming out of your eyes because you're trying to prevent that from going in. You're possibly going to get constriction of bronchioles. So whatever has come in, the nasty invader pathogen is not going to go deep into your lungs. So you get worsening of asthma or respiratory issues. You're going to have increased gastric acid, because what if the threat is coming in through your food? Right? We haven't yet ascertained what the threat is. So maybe it's going to come in through your food, because a lot of things come in through there. So you're going to really pump out that acid, right? Because we are going to kill whatever it is trying to make its way into your body. And we're going to make your skin itchy. Why? Because what if it's something that's on your skin? So we're going to make you itch it off. So all these are very sort of evolutionary drivers. And of course, because your ancient brain can't really, it's running on an ancient program, it just implements these programs, and it just runs. And sometimes it kind of does run away from itself until children are able to be held and supported, and they understand, and their pain is shared. And to be fair, all of us need that, right? We all need support in some way, shape, or form. We're just lucky we're able to voice our issues. We're lucky that we are able to move away from situations if we need to. But anyway, yeah, so that's my stories.
This was incredible. I'm really called to sit and meditate and inquire what's going on in my body right now. I think that our bodies are really brilliant at masking if there's an issue as well. Like we personally, I feel like I could easily go stronger, go harder, stay up later. You know,
Yeah,
my body was is pretty resilient. And
yeah,
then it catches up with me and I'm like, oh, here we
yeah.
go.
That damn prefrontal cortex mucking things up again.
Yeah, so this is really, really, I love the importance of regulating our emotions and tuning in, seeing what's going on. It's very, very empowering. If anybody out there thinks that they are matter of factly this way, they have eczema. That's just how it is. They have these conditions. Sounds to me like there's still more to try and still more to inquire to hopefully get to the root cause of this and feel empowered around that. Super, super inspiring. Thank you so much for your time today. If there's any conferences that you might be attending or speaking at, or any way people, do you have any, would you be open to
Yeah,
people contacting you or following
of
you?
course. So I put the conferences. I, damn, I think I need to update this. But anyway, I put the conferences that I'm speaking at on my website. So that's www.drolivialeslar, Lesslar.com. But I'll just send you like a list of things, I suppose, that I recommend for patients. I really feel that there is so much healing to be had and explored rather by patients with the right intentions. Of course, they should be guided by a health practitioner or a doctor. But it's not necessary for patients to pay to see me, for example, because there's so much that can be done before that.
Mm.
Always happy to see patients, of course. But yeah, I'll put some resources. I'll send you some resources to put in the show notes.
That would be awesome. Everything's linked down below. I appreciate you. Thank you so, so, so much. I hope you have the best day. Oh
Thank
my.
you.
Okay, we need to record again because we're talking about colitis. My sister has ulcerative colitis. This is really close to my heart.
Ah,
This type of-
okay. So just know that I'm very careful when I speak to my patients because I don't want them to think that they have the key to the lock, which is their disease, right? Because as it is, chronic disease puts one in a very precarious emotional state where there's going to be some blame, some guilt, some shame, some this, some that. It's my purpose is to make sure that patients are aware of the multitude of possible options available to them and to explore them with intention and with self-compassion. So this story I'm about to tell you is about a patient of mine from London. She was mid-30s when she came to see me. She knew someone who knew someone who knew me. And the reason why she finally sort of bit the bullet to go outside of the NHS, and the NHS is the National Health Service of the UK, it's because she'd been sick for 30 years with colitis of unknown reason, unknown cause. So it wasn't Crohn's and it wasn't ulcerative colitis. It wasn't celiac, but she had colitis. And by the end of 13 years, after some hardcore drugs and immune modulation and all the rest of it, they basically said that they were going to cut out her large bowels.
Mhm.
So that's why she came to see me.
Mhm.
Now, and this she is an index patient for me, and I think I said this on stage, if you remember. An index patient is a patient who teaches you something and
Mhm.
changes the course of your medical like thought process, basically. So what happened was at that stage, I had just started really getting into, hey, there might be emotional roots to physical symptoms. So, and like any good doctor, you sort of go through history, right? So tell me about like when you were a kid, like what happened there, right? And you uncover sad, traumatic stories. And at that stage, she didn't have colitis, but she did have other symptoms. And I said, do you think that possibly, and of course, looking through an evolutionary lens, looking through a psychoneuroimmunology lens, do you think that this thing you had with food then was because, your mom did that, and this thing about your back, it's because you didn't feel supported? I knew I was very confident in going down this road simply because she didn't need another doctor to tell her about larch or peppermint or licorice root or something. She'd done all that, right? So I'm here to talk about other things. And after a while, I was able to kind of predict the emotional stressors that were happening around a particular stage of her life just by the symptoms that she was giving me. Because sometimes it can be some of them do follow some sort of predictability patterns. Okay, this is things like German new medicine, for example, or even Ayurveda or traditional Chinese medicine. They do talk about certain emotional or spiritual states and the correlating physical symptoms. Okay, anyway, I don't practice these myself. I am not trained, but I make sure that I know a little bit about, just to, if I'm confused about a patient or not sure, you just sort of touch a little bit there just to see if there's something that sings to them. And anyway, by the time we were done with our 1 hour session, she herself said, wow, maybe my body is actually just trying to protect me. And she did this, and I will always remember that. She patted her head and she goes, good, buddy. Thank you, buddy. I appreciate you, buddy. And that was it. One session. Never saw her. Well, saw her again. I saw her in London when I went to London. I was in Australia at the time. Went to London a few weeks later. She could eat almost anything she wanted by that stage, and her colitis had cleared up.
Wow.
Now, if I hadn't seen this for myself and knew the patient, I probably wouldn't believe it. She has now since moved to Tampa, Florida. So I'm going to go see her on Thursday. And she's incredible, right? She's pregnant now. Whenever things go, actually, let me just read a text message.
Wow.
Whenever things don't go quite right, she will actually self-treat emotionally and spiritually, right? Energetically, or however one. By the way, like, I'm not religious, I'm agnostic, but that I use these words and I'm like, oh, I hope people don't like think that I'm trying to like push religion or something. And she has actually said that she will speak to anyone about what she went through just to tell them her story. So actually, I've got a friend in Australia who's going to like interview her because I need this story on now that I think we can do testimonials. I'm going to put this on my website because it's one session. Took myself out of work all the time, I tell you. But anyway, so let me read this to you. Okay. So she was pregnant and she couldn't eat salmon, I think. Okay. So she goes, this is on Sunday. Hello, how are you? Hope all is well. Just to update, I ate tuna and smoked salmon. So I think I finally healed my Christmas salmon related trauma because I think she ate something that was off and it pushed her immune system to the brink. And I'm back to having the DHA from fish oil pills and no bad side effects. And I said, that's fantastic. And I said, she said, happy pregnant lady, trying her best to have happy pregnant lady thoughts. Anyway, so
Absolutely brilliant. That's so awesome. I want to do that. Thank you.
yeah. And so, when I talk to my patients about that, you first of all, I don't know if you were there on the panel, you have to speak out loud. You have to talk out loud because the auditory system it hears external noises, right? So thoughts are one thing, but you have to say your affirmations. You have to say whatever it is for your nervous system. You got to say it out loud. Second is that you also have to approach it with gratitude. So thank you for turning on this inflammation, because inflammation, remember, short term is protective, long term, yes, there's collateral damage, but it's turning on inflammation because it's scared and it's running an ancient program. So thank you for trying to protect me. And then for me, I always talk to my nervous and immune system as if it was a 5-year-old. I will go through everything that led up to why the nervous and immune system got upset. Okay, so I have a wry neck. Well, what happened was I got into the car and I hit my knee on the door, and then I twisted my torso in a funny way, and I looked to the right really suddenly, and I think maybe because I didn't have very good sleep, and now I've got a wry neck. So look, thank you so much for trying to protect me. Thank you for the inflammation, but I just want to reassure you that I am safe, I am okay, I am happy, I am healthy, I am whole, right? And then just to say, look, just decrease inflammation, we're okay, all that kind of. I sound completely nuts, but it works for
No,
me
you
and it
don't. No,
works for
you
my
don't.
patients.
This
So,
is brilliant. Every word, every tool, absolutely brilliant. Thank you. Thank you
You're
so
welcome.
much. I really appreciate your time. This healed me today. I definitely needed to hear this. I'm sure a lot of people did. Thank you. Thank
You're
you so
welcome,
much.
Kate.
You're such a bright light. I cannot acknowledge enough. Can you believe, like, wow, all the stories that you have, all of the incredible magic. It just seems to me miracles are possible. They happen all the time. And I want to instill that in people. Thank you,
Yeah,
body. Oh, yeah.
yeah. Thank
Mm,
you, Katie.
thank you so, so, so much. Okay, I'm gonna let you
Okay.
go. But I don't want to stop recording in case you say something brilliant.
All right, take care.
Much love. Bye.
Bye. See ya.
Everyone, click the links below. Make sure you tell Dr. Olivia Lesslar on Instagram what you got from this. Oh, we are safe. We are healthy. That placebo effect is very powerful. Let's really, really make it happen. I was actually just on a patient call where she used to experience a lot of acid reflux, and instead of taking so many Tums, she's actually been visualizing taking the Tums without actually taking them and and seeing some benefit. Like really, really trying to like our mind doesn't know the difference between what's real and what's imagined. All right, let's imagine that we're taking that medicine. Hey, it can't hurt. It can't hurt, you know? Oh, y'all are amazing. Thank you so much for listening and taking care of yourselves. I really hope this helped. Let me know what you'd like to hear, what you'd like to see, and I can't wait for the next one. See ya. Bye.